Hello, friends out there. You're welcome again. Happy New Year. This is your friend, Nose. Okay. I hope you are coping. That's why the circumstances of this nation. We cope well, and I will go last past them. I beg. Don't give in to depression. Don't give in to anxieties, worries, and all that. It's going to head in praise. And that's, I believe. I just believe. It is well with all of us. So it's been a long time. So based on popular requests tonight, we want to discuss the differences between vaginal discharges and vagina, the normal wetness when somebody is, when you are ready for sex. There is a wetness, but people just say vaginal discharge. We all have normal vaginal normal discharges as women, and of course, when we are ready for sex, after you have been romanced, after the foreplay and all that, of course, you have there is a wetness that happens that time that is different from vaginal discharges or vaginal infection after vaginal discharges after somebody has vaginal infection. So most of the time we just say I have vaginal discharge, whereas you might not have vaginal infection. It might only be vaginal discharge, and we all have vaginal discharges. So we're going to be talking about the differences between vaginal discharges, then the wetness women feel when it is time for sex, when they have been aroused for sex, and of course we're going to be talking about when there is vaginal infection. How will the discharge be like as at that time? So let me just write it differences. So tonight, that's what we want to discuss mainly, so that we'll be able to. Some people just mix everything. We mix everything up. We mix it up, and we don't know the differences. That's what we want to do tonight. Okay, so we are there already. So simply, when we're talking about discharge, there are top things to know when we're talking about discharges. Then when we're talking about getting wet, there are things to know. We have discharges, we have vaginal infections, we have wetness or arousal fluid, right? And when we're talking about vagina, let's start from the vaginal infection. Vaginal infection can be, maybe you have sexually transmitted infection, or you have fungal infections, which of course might not be all the time sexual. Might be as a result of someone, maybe you are wearing tight pants, or you are not wearing cotton pants, you are wearing nylon pants, there is heat, or maybe somebody has low immunity, or somebody that is diabetic like a woman. A whole lot of things can cause vaginal infection. And when the discharges are coming because there is an infection, it might be colored, it might be yellowish, it might be brown, it might different colors, and there will be foul smelling. At times the smelling might be like the type that happens maybe when there is spoiled egg, you understand, something like that. All those ones might happen because they are vaginal infection. There is an infection, you understand. Now, but as a woman, we all have something we call normal flora. The normal flora is the one that will clean out inside of the uterus, that's our womb, that will come and clean out the vagina, like sweeping your room and a parlor, and somebody comes and push everything outside. After sweeping the room, you go straight to the parlor, you sweep the parlor, and from there you are sweeping it outside. It's just like that. So then when it is normal, you don't have vaginal infection, we have normal vaginal discharges that will just be coming just because the place has cleaned itself up and is coming out, just like when we are doing a period, the dirt and everything is coming out. Now that one, there won't be itching, there won't be pain, there won't be discoloration, no yellowish color like flagy color, no brownish, no offensive odor. But we all have vaginal discharges, and we have vaginal discharges that is normal, that is not offensive. Everybody does. So, but if your vaginal discharges, the normal one, when you are sure that you don't have vaginal infection, is now having foul smell, the color you don't understand, is something that you need to see your doctor as soon as possible. As soon as possible. So it's not something to joke with, you understand, because some men have had like this. What brought about this topic, the man is even ready to leave the girl, that the odor is too much and all that. You have to know how to take care of our private part as women, and so that you are welcome. We should know how to take care of our private part as women, so that if there is when you know the normal, you'll be able to know the abnormality. But when you don't know the normal, whether the time is having discoloration, whether the time that is smelling, or the time that the discharge is thick, you are just there. It calls for, I don't understand. We just have to know the normal so that we'll be able to know the abnormal. So those are the areas. Then when we're not talking about the arousal fluid is just when after foreplay, and most of the time when you are now wet, it's going to be slippery, something like that, like mucus is going to be slippery. It's not going to be something you touch and it's going to be slippery most of the time, for easy penetration of the penis, you understand. So we've talked about three things, the differences. Oh, you're welcome. The differences you will see between vaginal infection, vaginal discharges, and of course the wetness fluid, which is arousal fluid. So there are three different things. But most people say, I have vaginal discharge, I have vaginal discharge. It is not all vaginal discharges that infection that are not, it's not vaginal infection. But when there is itching, discoloration, thickness, and it's foul, it's smelling, you understand? Even you, before a man comes, you know that it's smelling. Maybe you are able to touch it, or you know that it's smelling, and this is not your usual odor. You will know if you have vaginal infection. So it's not all the discharges that are all vaginal infection, but all discharges can either be the arousal fluid, or the vaginal infection discharges, or the normal vaginal discharges. We all have that. But there is alteration when you have vaginal infection, or when we are having low immunity and you start having itching and all that. But if there is nothing like that, and the odor is just normal with you, there is no problem. So they are not all the same thing. So we shall be talking about how to identify each one, and what to do when your vaginal fluid start to look frothy, like bubbling or smelling, or it's just coming. It's not something, it's much, it's not, you have not experienced, just coming out. At times it can be like that. So that's what we want to know. That's if you are able to identify, this is the way my vaginal discharges stays when it is normal, you'll be able to know if there is any alteration when the thing is not normal again. So you have to know the differences between the abnormality and the normal. So we have to look for some things if it's abnormal. And when it comes to discharge, it's just an umbrella form of fluid that comes out of the vagina. It's just, when we say discharge, either the arousal fluid is a discharge because it's post foreplay. The vaginal discharge, which is the normal, is still fluid. The vaginal infection discharge is still fluid. So all of them are just fluid. But when we're talking about the cervical fluid, that's the cervix, between the uterus and the womb, which is the vagina and the womb, there is a door, which is like from the uterus, which is the room. We want to come to the parlor. There is a door between the uterus and the vagina. We call it cervix. It's like the middle door. If you want to leave your room, you want to go inside the sitting room. So it's like a middle door. So we have cervical fluid, and of course that one changes throughout the time, to encourage the sperm to be able to enter into the uterus. At times when somebody have problems with the cervical fluid, if the cervical fluid is not the way, the composition, the way it's supposed to feel, sperm will not be able to swim to get into the uterus or the womb to be able to attach itself to the sperm, to the egg that the woman has released. So if there's any abnormality in cervical fluid, it's one of the causes of infertility. So that's one. It facilitates the movement of sperm so that it will be able to pass from the cervix down. Then the arousal fluid, I've told you that one is just the one that is created within the foreplay. You want to have sex, or you are not even with the person you want to have sex with. You are just somewhere, you just remember somebody that you love and you just feel moved. Arousal fluid will just come. I want usually slippery most of the times, and it's easy to be able, you'll be able to know that this is the different. This thing was not there again before. The normal vaginal discharge was there, or maybe you have vaginal infection, there is discharges, it's also there. Then apart from that, that one is just a response to a touch or a thought. Then you may notice sometimes your vagina feels really wet out of nowhere. So it might be maybe you need to use the bathroom, maybe it's just ordinary moisture or something that is happening. So it's not all the time that you say I have an infection, and you are taking ampiclox and flagyl for what is not. So we have to know cervical fluid is part of the discharge. But if you are not on any hormonal birth control, the quality, if you are on hormonal birth control, you don't want to get pregnant, the quality of and the quantity of your cervical fluid will change throughout the cycle. Or for example, let's say you start your menstruation on the 1st, the cervical, at that time, because there is bleeding, there is nothing that you receive. Then if you finish the menstruation, the cervical fluid changes. If you finish that, you move on to the time of ovulation, there will be changes in your cervical fluid, because that time during ovulation your body recognizes that you need sperm for the egg to be able to get pregnant. So there are disparity in all those ones. So cervical fluid changes throughout your cycle, except you are using birth control pills, your hormonal pills, you don't want to get pregnant. That is the time. And these changes will just start from your cervix and occurs in response to hormonal fluctuation of estrogen and progesterone that is preparing your body for ovulation, menses, or even pregnancy. That is it. So on the other hand, vaginal discharge is the medical term used to describe the fluid that comes out of the vagina. I've explained that it's not an infection, it's the normal bacteria, the normal flora that is in our body. They help us to wash both the vagina and the uterus, and they bring it out. That's why there is no day you see different kinds of discharges inside your body, outside your body, that's inside your palm, that's left the normal place. Then when we are talking about discharge generally, it's a generalized term and is made up of cells from the cervix and vagina, bacteria, mucus, and water. So, and people, by the time you start entering menopause, gradually there is a reduction in the vaginal discharge. At times you might be dry for a whole day. Menopausal, they typically have less discharges because the level of estrogen and progesterone in their body is being reduced, and when it's reducing, there will be less Blink 128. Who is this? There will be less by the time you are getting to menopause. Gradually, it will become, there will be reduction because your estrogen that is responsible for all this menstruation, ovulation, and all that is reducing. And when it's reducing, there is, probability that there will be reduction in those areas. Then apart from that, according to his research, it is normal to have about 1.5 to 2 teaspoons of let's say about 2 to 5 ml daily of white, clear, mostly odorless mucus like discharge. You understand? It is possible, just like that. Then of course you may feel wetter and have a higher sex drive near ovulation, and it's just due to increase in the estrogen. But when you are now going towards menopause, there is a reduction in those things. Then fertile cervical fluid around ovulation provides additional lubrication. During that ovulation period, provides additional lubrication. The consistency, it will become slippery, sticky, or pasty. The way it will just look like, depending on how at times stretchy, as well as sensation. It might be wet or dry or cervical mucus. Then what is arousal fluid? We're talking about arousal fluid. Getting wet during sexual activity is a normal physiological reaction. You are not abnormal if you feel wet. because to prepare you for sex. It's a normal reaction preparing you for sex. However, sexual arousal is both a physiological and psychological response. You understand? Now, when we're talking about psychological, it's coming from your mind. I want to have sex. Okay, if I want to have sex, I might not even be touched before I get wet. Somebody might say, oh no, I need a lot of foreplay before I'm ready. Somebody, or you might be going on a visit, or you might be going home to meet your spouse, and it might be along the way or long before you get home that you are really feeling them, that you are missing, that you want to have sex. It might be that when you get home that the action will start. You don't even have plans for that ab initio. So that's why they say for sex it has to be both psychological. That is your emotion, your mind, your psyche has to be involved when it comes to sex. And of course the physical, the physiological is part of it. The process of the physiological is now the aftermath. When your emotion has been worked on, that you are ready to have sex, then the physiological is the production of those fluid to make you wet, so that you'll be able to have good sex. Yeah, so that's why I said it's both physiological and psychological. But the psychological comes first. It's like when you want to eat, oh, I feel like eating these things, and when you eat it, you feel fulfilled. You understand? It was your psyche that started it. You understand? Then the physiological will now finish it, just like something close to that. So then the female physical sexual arousal begins with the excitement phase. When we're talking about sexual phase, we have various we have the excitement phase, we have the arousal phase. Then after the sex, you have had your this thing, you have enjoyed yourself, then everything things out. So we are not going to talking about these stages of sexual intercourse now. We want to talk about strictly the discharges and all that. So the physical sexual arousal begins in female with the excitement phase, when you are getting excited, and that is the time the clitoris becomes bigger. You start, there is swollenness of the clitoris. There is excitement because your body is preparing you to have sex and you are interested. There will be increase in genital blood flow, and that's why those areas they are filled with blood. And when they are filled with blood, it is easier for you to get aroused. That's why in some women that have entered menopause, because there is reduction in progesterone and estrogen, it becomes difficult for us to enjoy sex, because all these things that are working here and there for you to both physiologically and psychologically for you to have good sex, there is reduction in them. And when there is reduction, you start feeling you're no longer interested in sex, unlike the time you were still active as maybe during childbearing age, and you want sex all the time. So number two, because of that increased blood flow, then there is pressure. So when there is pressure, the vagina is swollen, the cervix is ready, the clitoris is ready. When the clitoris is ready, vagina is ready, everywhere is ready. Of course, the psychological was the first. The physiological, now all those things that are happening, that you are getting wet, all the clitoris, the vagina is swollen because of blood flow to that area, the blood vessels are engorged. It has come to physiological point. And when it's like that, once you are fully physically sexually aroused, it is normal to feel vaginal sensation, swollenness. That's what leads to swollenness. And of course, after that swollenness of the clitoris and all that, you are ready for sex. That's why we have differences. So that time, the fluid inside your vagina as at that time is arousal or wetness fluid, not vaginal discharge. You won't say vaginal infection. So when you are saying vaginal infection is different, when you are saying vaginal discharge is different, arousal discharge is different. The composition, the everything, the ingredient inside each are different. You're welcome. 5 sticks. It's different. So if it's different, you can't call everything vaginal discharge. You can't call everything vaginal infection. That's why most of the time we don't even know when we have, some of us, we don't even know when we have vaginal infection or when we have vaginal discharge or when you are even wet. Some have ordinary vaginal discharge, and when they want to have sex, they believe they are wet, whereas they are not. It might be ordinary. The normal discharge has been with you in the morning, maybe in the night you're getting home, you want to have sex and you think, oh, I'm wet. And by the time the man penetrates, you will start having pain, because the vaginal discharge, the normal vaginal discharge, is not slippery. It will not take you to get wet, except you just want to give the man the chance to maybe do his first round, and later you relax, you make him relax so that you can do more. But if not, vaginal discharge will not make you enjoy sex. It cannot make, especially for the women, cannot make you enjoy good sex. It's just like you're just do, and let's get out of here, because maybe you're tired or something. Your body is not, the psychological aspect was not really ready before you want to move on to do that. So arousal fluid is vaginal lubrication created to enable painless penetration and movement. So abeg go, the person wey wan say wan leave im girlfriend abi im woman because of this, I hope you get to see this video, though you are not around tonight. This video was meant for you. Abeg, don't drive her. So things that can make it easy or more difficult to produce arousal fluid. If you are not able to produce arousal fluid, what can be the cause? Number one, foreplay. If there's no foreplay or not enough foreplay, if you just do foreplay, especially as a man, you know, men are moved by what they see, while we are moved by his petting and all that. If a man is not taking it easy, or there is no foreplay at all, or little foreplay, and the woman has not gotten aroused, and there is no wetness fluid, the sex might not be too good. Might be difficult for you to enjoy that sex. Then number two is your mental status, your mental state. Like we said, I have an issue that sex has to do first with psychological. Okay, am I ready? Do I want to do this? Okay, do I love this person, or is it just the sex? You know, if your mind is not there, even if the man is trying to do everything, or the woman, or the other way, is trying to make sure you are really, you are really into them, you want to have sex with them. If your mental state is not, it's like a man that gets home and he has some businesses outside, and children are crying for school fees, the wife needs money, there is a lot of bills to settle, and this man now believes that he's going to get one business. They have promised him, but the way Nigeria is now, he now comes back, there is no job, talk less of money, and they're about to drive his children from school. If the woman is trying to even touch the pennies might not rise. We are all adults, we know how it was. You'll be thinking, will they drive my children from school and all that? The pennies will not even come up. It's just like women too. But the only beauty of it is that it's not all the time that women should expect to enjoy sex, because at times the man might be ready up to the point of no return, that he might not even want to even do any for gaining, before some of them will just have premature ejaculation, because when they are ready, when they are over ready. So don't expect, you should not be a quarrel, because I have had to settle some quarrel like that is always coming, and when I'm not ready, of course, that's the way men are made. So we have to, how do I say, we have to understand with them. And of course, you as the man too, if you're able to come early, you make sure you make it up to your women. Make it up to your women. Sex is beautiful, but most of the time you see that it's been causing wahala. And for some time I've not been online. I just felt that maybe we have done enough, but I just found out today that we have not done much. Because the person had to chat, and this is what I'm going through, and I saw something on your page. I said, okay, let me come now, so that I'll be able to watch this at least after this time out. Then there are some things that can, of course, not allow the arousal fluid to be there. Certain medications, such as hormonal, if you're on birth control pill as a woman, at times you might not be able to have that arousal fluid. Then at times, like somebody like me, I'm not a lover of condom, so there is no how. Maybe I'm wet, I'm aroused, immediately condom is used. The whole form, the whole thing, both psychologically and physically within me is dead. So some, maybe because hormonal pill or birth control pill, or some when they use condom, somebody like me, it will crash, and all the wetness will end up drying up, because I'm no longer, as at that time, I'm no longer participating. I'm just there because you needed to do your thing. So I'll wait for you to do your thing and get off. So there are a whole lot of things that can make the arousal fluid not to function. Then one of it is fluctuating levels of estrogen. Throughout the menstrual cycle, there's something we call menstruation. There's menstrual cycles, just like a wall clock. And that wall clock, now assuming when the wall clock is by 12 noon, by 12, and is working like that until it comes back to 12 again. Then during menstrual phase, that, let's say menstruation started at that 12 and is ending at 12:05, the hormone, the estrogen level in the body will be different from the time the body is preparing for ovulation, which is close to on the 10, 12, depending on your menstrual cycle days. You understand? Any menstruation that is less than 23 days and higher than 35 days, it is possible the person is not ovulating and might not be able to get pregnant. Then, if it's now between 23 and 35 days, there is a mid-line, a thin line that we can, be able to calculate for them to be able to get pregnant. So for you, throughout those periods, there are times in the menstrual phase that as a woman you'll be dry. There are a time in the menstrual phase, like the ovulation, you have cervical mucus that is stretchy, that if even without enough arousal, the fluid will be thin and it will be easy, because the body is preparing your body. The cervix, there's something we call cervical fluid. It's just for easy motility, that is movement of the sperm inside the uterus. So the body produces that cervical fluid as at that time. So at that time it's wet, so you can even have sex because it's not thick. You can have sex and you still enjoy it because it's already is thin as at that time. You call it cervical fluid. So apart from that, then at a stage in that menstrual cycle, the vagina discharge becomes so thick and it becomes a problem. And you can't say that is what? That is a vaginal infection. Not all vaginal discharges are vaginal infection. Right. So that's what we are discussing tonight. Then it can be frustrating if your body doesn't represent the feelings of arousal, and you are with your arousal in your mind and partner, and at times you make your partners feel as if they are not worth it, or as if you are not into them. Maybe they are the one that is into you. So, but cervical fluid is an indicator of being wet. That is it. So, number one, how do we want to do to be able to keep ourselves wet? Number one, communication is the key during sexual activity with a partner. You have to be able to talk. Keep talking. And the rule of communication is don't assume. He should know now. He should know that I'm on now. He should know that I'm ready now. He should know that I'm wet now. And no, you speak up. If there is foreplay and the man wants to penetrate, or the woman say, okay, I'm ready, and the man is not ready, still want more foreplay, or the woman want more foreplay, they are not witches and wizards. It's you that will open your mouth and say, okay, I'm ready, you can come. No, wait, this is the way I want to be touched. This is where I want to be touched. So most of these adults quarrel inside because of sex. They are not supposed to be. They are not supposed to be. We know it is easier for men to go out because they are men. The way they are being made, the physiology of their own sexual activity is crazy. That's why most of the time men sleep around. They do all manners of things. But we know they do like that. We know they do like, we have to pet before we get moved. You understand? So communication is the key. Never you assume. We don't date this house now for 2 weeks. This man know they touch me. You know they even look back. You don't know what is in his mind. This woman self now 2 weeks like this. You know they agree me touch her. What is she going through? Do you know the deep things? Or you are not talking at all about those things? Or maybe they are having like some a couple that I met. The man was having erectile dysfunction, and instead of the wife to be concerned, he was just saying, hey, is this all you want to do? And you are just disturbing me. And now 1 minute you are finished. And that's how the man just withdrew. 3 months, the man not even asked for the sex, and she was thinking we asked before 6 months, and they were gradually drifting apart. And before they can now speak up, while I done the shell for the house, the man for the woman the office, they don't get one girl where they tell her and say, you are good, let's try this. And the girl was even buying all this concoction for the man to make sure that the penis was working, whereas the wife was just complaining and nagging. And she 2 minutes, is this 2 minutes that you are doing, and you are just shouting that you are disturbing me, and these 2 minutes. When you make someone, both male and female, when you make somebody to lose their self-esteem and self-confidence, you have killed them 50%. They are dead 50%. If there is English like that, 50%. When you make somebody to feel less human, when you make somebody to feel less, confidence with themselves, when you make them feel less human. So they lose their self-confidence, they lose their trust in you, they lose their self-esteem. And when you lose your self-esteem, it can lead to depression. When you lose your self-confidence, it can lead to having depression or suicidal thoughts. Some people want to go and kill. I was in a relationship for like 6 years when I was single. After everything, and this guy and the mama said they don't want me. Hey, my self-esteem was 0 level. It was 0 level. In fact, after like 2 years, the first guy I met was not even, let's say, ordinarily somebody that I could date. It was not. Maybe you're welcome. It was not somebody that I could date. But because I was coming from a bad relationship, I just jumped in on the guy. Because my self-esteem was 0. And my self-confidence was dead. So don't make people feel less human. Don't make them feel they are not worth it. We are all equal. It's just that, circumstances of life is not balanced. Life is not fair. Things will happen that will make some class, feel. There's something we call social stratification in psychology. They believe in behavioral psychology. They believe, I'm better than you. I'm in America. I'm better than you. My parents are rich. I'm better than you. I attended Harvard University. And you, even within Nigeria, somebody that attended a federal university like Unilag or Obafemi Awolowo, they will still be feeling as if they are better than the people that attended LASU. And the people that now went to Babcock, Covenant University, we think they are better than people that are gone to Unilag or the state or a university or something. There are bound to be social stratification in this life that we have. There are bound to be social stratification. But I've come to tell you that we are the same thing. When it's time to die, it is the same 6 feet. Somebody that is tall. I know of one politician that died during Koro. This guy was tall, very huge. I was thinking, how will 6 feet take this guy as tall as he was? My brother, it was 6 feet that they buried him. He was buried inside 6 feet. So we should not make ourselves to feel. There are some things that we say, especially women. If you are telling your husband it's 2 minutes no do, kí n tójú ẹlẹ́sẹ̀ mẹ́fà ẹlẹ́sẹ̀ mẹ́wàá oníkà mẹ́fà or something like that, we should watch our mouth. Your breast is too big. When did you now become so fat like this? When did you now, those are the things that can kill. They kill our self-esteem, kill our body, and it's just like that. So, number one, we were talking about communication, which is the key. Then number two, if you feel turned on, but you are struggling with producing arousal fluid, wait a little bit. You can express, like we're still talking about communication, you can express what you need to get, so that things can be faster. You don't need to waste time on bed. You don't need to waste time. So maybe you might need a lubrication, and it's not only if you don't have a water-based lubrication like KY jelly, you don't have a vagina, you don't have like oil, you don't have anything. Maybe you are just there. It's not even. Maybe it might not even be your own. Your saliva is a form of lubrication. The saliva is good for lubrication. The pH and everything is good. You can use that. So don't be waiting. It's because we don't have anointing oil. It's because we don't have a vegetable oil. Use your saliva. It's enough of lubrication you can get from the woman, and you too, as the man, can donate. Understand? Or if it's going to be something, maybe you don't like it, you go for your lubricant. Water-based lubricants are good. It's not everything you can incite into the vagina, all in the name of having sex, because of vagina, because of cervical and uterine cancers. Don't just put anything. And if you want to use your birth control pills, know the content of what they are giving you before you put it. Know the content. Don't just say my friend is using Postinol and you carry Postinol. Do you know what is inside Postinol? Do you know what prolonged usage of Postinol will do to you? Don't say my friend is using injection. It's 33-month injection and you are taking. You don't know. Know what you are getting into your body. Then we men too, we should not, because I've had complaints of a couple, that the wife was still breastfeeding, and the man was just wanted sex. At the end of the day, the woman got pregnant, and he was furious. And you are breastfeeding. Why did you get pregnant? If you love me, birth control, family planning should not be my sole responsibility. It should not be my sole prerogative. It should be our prerogatives. I'm your wife or your partner or your girlfriend or whatever. If it is to remove cervix or uterus, to remove uterus because of this thing, it is women. To cut tube, it is women. To take injection, it is women. To do Postinol, it is women. To take family tablet, family control tablet, it is women. Women don't. So let's make sure we do what is right. One study found that the lubricant used was associated with higher rating of sexual pleasure and increased wetness, and it made orgasm easier. When there is wetness, or if the wetness is not coming, if you are able to use lubricant, especially the water base, that water base is, if you look at it, is what we even use in the hospital to insert catheter. We put it at the tip of the catheter before insertion, enter either into the male organ or the female organ. So because it's close to that wetness fluid, it's close to that when you are wet, that arousal fluid, that's vagina, that essentially KY jelly, we have various types of water lubricant. They are very good when it comes to sex. So they are telling us here that most of the time when we use that, it makes sex more pleasurable and both of you can, reach orgasm maybe about the same time, or differently, but it makes sex beautiful, and it keeps you coming for more. Then apart from that, if you don't feel sexual desire and you are not producing arousal fluid, it could be that you are into the act you are doing with your partner, or you have low libido. If all these things are in place, there's communication, good for foreplay, there is no wetness, you able to use the water-based lubrication, or your saliva or something to lubricate the woman, and you are still not getting aroused. It might be that you are having issue with low libido, or erectile dysfunction. We have low libido, we have erectile dysfunction, and some of the sexual dysfunctions. We have low libido, we have erectile dysfunction, we have premature ejaculation. It might be that you are having issues, so you have to see your doctor, especially once in a while. At least certain percentage of men, we have erectile dysfunction, or any sexual dysfunction. It might be premature, it might be erectile, but so all the time it depends on who you are with. They are able to, there's a way, there are things that you can do, and it will make you go back to normal. My husband has experienced that in the past, and we just joke about it. I won't make him feel less. No. The highest you can just tell the man, like please, no, I still want more. Just our brain, the psyche, is very, very vital to motivate ourselves, influence ourselves, and of course encourage ourselves. There is no relationship that is rosy. There is none. The relationship that is rosy, maybe one of them is inside the grave. If you say, my marriage is 120%, it's a lie. It's a lie. There's something that will be a pain that you want that man or that woman to change, and they are not ready to change. If you are able to get a man that has 50%, I beg, or a woman that has 50%, give the remaining 50% to God and move on with your life. Except you want the person, you want to go and get somebody that the only perfect person is inside the grave. Chikena. So then, or maybe you have low libido, or as a woman you have menopause, and during menopause, only pie, happy 3 new years. Báwo ni àwọn ọmọ mi ń kọ́ àti dádì wọn? Oh my God. Ẹ̀yin aráàlú òyìnbó ẹ̀ kì í sí lórí social media bíi tàwa ń bì. So maybe menopause because there's reduction in the estrogen level, and then you start having low libido, low sexual drive, you don't want to have sex. Or maybe during breastfeeding, because you are just coming out of the process of birthing your child. There are a whole lot of hormones. Your hormones that was actually working clockwise prior to the time of pregnancy has now decided, is now taking it easy, and there will be suppression of some hormone while some hormone takes place. So most of the times, women don't even want to have sex. Maybe the time there's something we call involution, where the uterus that was, the process of the uterus coming back to its normal face, the normal place, the normal or something back into where it was before it came out to carry that baby. So most of the time, there is hormonal fluctuation. This one scatter, this one is higher, this one is trying to go down. So you might not have interest in having sex. So the issue of being aroused and getting wet might be something that is difficult for you as a woman. So the more reason you need the water-based lubricant, the KY jelly and all the likes, the water-based, I tell you, is the best. I've tried it and I know what I'm talking about. And of course, at times there are some drugs that you are being placed, like antihypertensive drugs. Some of them can give they give some men erectile dysfunction. They give some people low libido, they have low sexual drive, they don't want to have sex. So if you are having something like that, you should be able to see your doctor and let them know, like lisinopril, like an antidepressant we call lisinopril, we make some people to be coughing. Like amlodipine, some serious headache, some low libido. So we have a whole lot of all these drugs. If there is anything that you are noticing after a particular drug has been prescribed, don't just drop it. Don't just pick one from your friend and say, oh, you too, you are hypertensive. Oh, okay. It's S-amlodipine that you are using. But say, oh, let me use that one. No. Go back and see your doctor. Go back and see your doctor. So apart from that, some medication, then your emotions. Some women have what we call the postpartum depression after pregnancy. You know, the physiological and the psychological changes after you have given birth, or maybe the man is not supportive, or maybe you have in-law issues, toxic people around you, or you have your own personal issues. Some so that material time, they come with postpartum depression. It's either they withdraw, they are not happy, they are moody. You know, the baby is there to even excite them. It is not exciting to them that they even have babies. So if there is alteration in your in the hormones in your body, of course it can lead to what we call FG mental bowing. It can lead to what we call the postpartum depression. We have a whole lot of reasons that causes that, right? Maybe you have been abused and you have not been reprocessed. There's something we call reprocessing. If you are not been reprocessed after a trauma, you can have PTSD. And if you just stay like that with your PTSD and you just get married and you're having children, and you are just getting married, and you don't even have a caring partner that believes this pregnancy is yours, you are the one looking for pregnancy, or you have in-law issue, or a whole lot of issue can lead to postpartum depression. And somebody like that might not be interested in sex. They might not want to have sex. Somebody that might not even want to bath. You know, when you come, there are a whole lot of when we're talking about depression, a whole lot of things that are all encompassing when we talk about the symptoms. But most of the time the signs are there, but we don't take note on time. By the time they start saying, people that are going to depression they must have been showing you the signs, but we don't get it. It moves to symptoms and becomes an issue. So most of them, they don't want to have sex, and it's a whole lot of problem, because a whole lot of things are influencing their sexual response cycle, maybe the post-birth, and amen. So maybe something like that is some of the things that might not make you to have wetness, or have be aroused and have arousal fluid before sex. Then when we're not talking about the abnormal discharges, you understand, that's vaginal infection that we've talked about initially. A typical discharge can be an indication of a problem, which can be bacterial vaginosis, can be fungal infection, it can be maybe you're having sexually transmitted infection, a whole lot of things. Alteration in the normal flora. Like I said, the normal flora are just those bacteria that is in our body. They are in the nose, in the skin, on the scalp, inside the uterus, the vagina, everywhere. There's just like bacteria, like a soldier bacteria that has been placed to fight against external invasion of those external bacteria that are coming in. But when there is a compromise, you have low immunity, you are not eating fine, or you are used to eating inorganic food like your Indomie, your fast food, your mineral, your energy drink. You are not eating organic food, you are not drinking enough water, you don't have enough fruits on your table, on your plate. What happens? You have low immunity, and when you have low immunity, if somebody is with you, just cough, you will pick it. If somebody is having catarrh, you will pick it, because you are having low immunity. So likewise, for some women that are if there is excess, our body is supposed to be more of salt than sugar. If your own body now comes down to excess sugar, and the blood is becoming less, there's an issue. As a woman, you can come down with the common place, the common thing they call it, they say a toilet disease. And so let us call it like that so that people will know. But it's actually a fungal infection. It's not only all the time that you have it that you are diabetic. It might be that you are diabetic. It might be that you have low immunity. It might be that maybe the way you are keeping yourself, you have exposed your private part to some things. Maybe the kind of pant you are wearing, you are not wearing the cotton pant, it's nylon pant you are used to wearing. It can lead to vaginal infection, all those things. And most of the time you see that they look frothy, like bubbling, they are smelling, some are thick, the discharges are color like something close to you, I can't say, maybe yellow, something close to flagyl color. We all know flagyl because it's our drug in this part of the world. Go and use flagyl, go and use flagyl. If the people use flagyl, you understand? So it's something like that, and it's going to be smelling. Like what brought me out is just this person that says the fiance's vagina used to smell. So at the end of the day, we have to look at it, go and do tests. There was nothing. It's just the normal discharge. So there's difference between vaginal discharge, arousal fluid, and of course the vaginal infection. We all have vaginal discharges as women. Then the difference comes, how are we able to differentiate between vaginal infection, pretty toasting, vaginal infection that will bring vaginal discharge, that's foul smelling, all those. Then the difference between the arousal fluid, you understand, or the cervical fluid during the time during our ovulation, so that we help the sperm to progress into where it will go and meet the egg. So how do we know? That's where we've come outside this time. So I was saying it can be a bacterial vaginosis, it can be a yeast infection, like I was saying, that fungal infection, or essentially transmitted infection like trichomoniasis. But how do you know the differences? So when it comes to vaginal discharge, the color can be crayfish in color. You know crayfish color. Some will say brown, but I won't say brown like that. Just like crayfish color. Some might be greenish in color. You should know if there's something like that, that this is an infection. It is not wet. No, it's not. So it can be greenish in color. It can be yellowish. Of course, brownish. We all know all those colors. And apart from the brownish, the yellowish, the greenish, and the crayfish color, the volume is usually significant. When you are going through ovulation, or when after foreplay and you are ready for sex, the volume of the fluid, the arousal fluid that comes, is not much. It's not much, except for some women that when they want to release, there is a way that their clitoris works, and that one is another case. But when it is normal, you understand, there is no problem. It will not be much. But for vaginal infection, it will be much. It will be much. It will be smelling. So the amount will be significant, and of course there will be itching. If there's itching, that one is not arousal fluid, it's not cervical fluid, it's not wetness fluid though. It is infection that has to be taken care of. And if you have been having sex with your partner with itchy, brownish, yellowish, greenish, or crayfish color discharges, if you want to start treatment, it is better for the two of you to do it together. If the both of you don't do it together, there is possibility of the man reinfecting you. Assume you want to take that drug for 6 days, let the man start the same day. No matter how pressed you are, you should be able to abstain. But if you don't want to abstain, there should be strict usage of condom. If you don't allow if the man is not treated, and the man believes that now you get vaginal discharge, now your body dey smell, and he has penetrated without protection inside of you after your treatment, is still coming to give you what he has taken from you. So it is better for you to take the both of you to take the treatment for sexually transmitted infection, bacteria, vaginosis, is it fungal, whatever kind of infection you want to treat that you know is abnormal. Both of you should take it. Not of both of them. If not, there will be reinfection. It's like going back to your zoo. There will be reinfection. So we've talked about the volume going to be much when it is infection. Then consistency, the fluid becomes way thinner or thicker and more textured. You understand? Because if it is arousal fluid, we know it's arousal fluid, just stretchy like that, slippery, to enable the sperm to move so that it's going to go and meet the egg. But this one is not easy because the consistency is much and it is not as slippery as arousal fluid is. It's thicker. It's thicker most of the times. Then the smell, unpleasant, fishy, metallic, foul smelling, as if there is egg. You know, when you have not boiled your egg and the egg is just there, 1 day, 2 days, and maybe 1 week, you have left it, and by the time you want to break this egg, you now cut it. You know the way it used to. Exactly. Then there is metallic odor. What will I liken that to? You know, when you leave your urine like 1 or 2 days. Let's say you wee the morning of today, which is Sunday, and after you have left that, you now leave that urine covered till tomorrow morning. By the time you open it, though it's ammonia, but you know it's going to be shocky because this urine has stayed like up to 24 hours. By the time you open it, it will be shocky. So something close to that. That's the kind of smell that we're talking about. The kind of smell that we're talking about when it comes to vaginal infection. Then when it's itchy, and when somebody can tell you, come and buy something, insert it into your vagina. I beg, all these hygiene is all lie. Most of it are lies. So somebody will say, is it that thing will stop the discharges from your uterus? Cervical cancer is uterine cancer. It's not funny. Oh, don't just insert anything into your vagina. Or because you have treated somebody that just put toilet through, you say because it's itching, he dipped it inside the vagina, up there. Because of that, it's just simple things that you do, and the vaginal infection is off. So, but for vagina, for the normal vaginal discharge, you have to, number one, like when I was teaching about 2 or 3 weeks ago, I told them, for you to be able to pick cancer on time, for breast cancer, you should know the normal. How does my breast look like on a norm? So that I'll be able to know the abnormal. Or if I'm not able to pick the normal, how do I want to know the day of abnormality? Is my nipple jutted out? Is it inverted? Is it retracted? I don't know. I just know, say I get breast and I'm 20 plus, 30 plus. Waiting now. Know your body like the palm of your hand. So the day of abnormality, you know this was not there. This is not. I don't think, not that they'll be asking questions in the hospital and you are like, no, I know remember. I know they too sure. We sure. So women, you know, our body is so complicated. A whole lot of things are brewing and we will not even know until it has, eaten deep. So the more reason we should know the norm from abnorm. So for the cervical fluid, which is an indicator of being wet, will be very slippery. The volume is not much, but the volume is enough so for a standard sexual activity to take place, because it will be able to take in the penis, and you will feel it, and the man too will know there is wetness. And it's the same thing, like the arousal or the wetness field. So those are the differences between the cervical, the arousal, vagina infection. So it's not the same thing. So if there are questions, let us know. So if there are questions, I'm waiting. FG Mentor, are you still online? FG Mentor, you have gone. Olipa, are you still there? Tosin, are you still there? All right, in the absence of no question, Abiodun David, Happy New Year. So, who is still there? All right, good night. See you. See you. Bye-bye.